if you look kind of down, don't worry about all of these, like, you know, really complicated things. Thankfully for your course, you don't need to know all those, which is wonderful. We talked about, we talked about this clotting, this fibrinolytic system. That's this kind of thing that's going on here. You don't need to know any more about that. One of the other things that's being released here during this process are these things called kinins, and they're really just another kind of inflammatory mediator. Really, the one we're going to talk about is the bradykinin. Okay, so that's also being released during this kind of vascular response, where for the most part, we said, remember we said that histamine was being released. We said down here, sorry, we said down here, remember we talked about, oh, the platelets are collecting, and then here the pro-inflammatory mediators like histamine and prostaglandin are released. Where do those come from? For the most part, those are coming from your mast cells. Mast cells are these big cells that are already floating around in your blood, okay? And what happens is when the inflammatory response is triggered, it triggers these mast cells to break down. You don't necessarily need to know any of this stuff down here. It's just helpful, I think, to know, okay, this is where it's coming from. It is helpful. So kind of, you might not get a question about a mast cell breaking down, but it's definitely going to help you answer the questions if you can have an idea of what's going on. So that's where the histamine is coming from the breakdown of the mast cell. So you've got those bradykinins, you've got histamine, you've got prostaglandins, nitric oxide, leukotrienes. These are all these things that are being, you know, released from those initial phases of the response, or the inflammatory response. Part of what those inflammatory mediators do is they attract white blood cells to the site of injury. So they're pulling, or they're calling out to the white blood cells to come to that site. And that process of being called from where they originate, which is usually the bone marrow or somewhere in the lymphatic system, being called from those places to a site of injury, that process of them traveling, that is called chemotaxis. Okay, so you have, these are chemotactic agents. This bradykinin, prostaglandins, leukotrienes especially are very strong chemotactic agents, and what that means is they attract white blood cells to the site. I can't remember a single one of my exams that didn't ask me what chemotaxis was, so it's good to really have a good understanding of what that is. But it's fairly simple. There isn't a whole lot of you don't have to go any deeper than that. That's it. So what exactly are they calling to that site of injury? Okay, and again, we're talking about our cellular response. Again, we're here still in this second line of defense here, but now we're talking, instead of about what's happening in the vascular and the blood system, we're talking about what's happening in the cells. Okay, so we've called those inflammatory mediators are calling these white blood cells. So I do find that people struggle a little bit with remembering, like, you know, what the white blood cells are and what they do. And so I just made this little chart because I figured, okay, let's just hit this really quickly. There's 5 main categories or main types of leukocytes. Again, when you break down this word, I know you guys know what a leukocyte is, but it'll help you later. Whenever you see cyte, we're talking cell, right? Whenever you see leuc, we're talking white. So in this case, we're talking white blood cell. Pretty simple. Oops, sorry about that. And so, just going to mute my computer there, but some other students questioning. So let's talk about monocytes. Monocytes make up about 4 to 8% of the white cell count in your blood. Their main job is phagocytosis. We'll talk about that later, but it's basically just the engulfment of whatever foreign particle or pathogen has entered through that first line of defense. It's going to engulf it, so we call that phagocytosis. Neutrophils, these are your main fighters, really, especially in terms of like a bacterial infection. They make up about 75%. It's a very large percentage of your leukocytes. These numbers, guys, are going to be different depending on what textbook you read. So you don't need to memorize them. Just knowing that most of your white blood cells are neutrophils. And that those neutrophils perform phagocytosis. We'll talk about that later. You also have then, so these two white blood cells here are non-specific. Okay, they will fight. They're phagocytic. They're going to engulf, attack, and engulf and clean up anything that is breaks through that system. Whereas these other three are a little bit more specific. So your lymphocytes, these make up anywhere between 16 to 45% of your white blood cell count. Your lymphocytes, their main purpose is creating an immune response. So you remember learning about it's like helper T cells and B cells. Those are types of lymphocytes. These lymphocytes are playing a role here. Okay, they're playing a role here in this third line of defense, this specific line of defense. So in terms of the cellular response here, they're not involved. Okay, we're really focusing on these macrophages and monocytes, macrophages, and neutrophils. Same with the eosinophils and basophils. There's a lot less of them. Again, these numbers are going to change depending on what you read. The idea is that there are a lot less of them, and they're much, much more concerned with dealing with an allergic response than they are with, you know, a non-specific pathogen or injury to the body. And I know you guys know this, but our normal white blood cell count should be somewhere between 4 and 11. I think that your slide said like 4.3 to 10.8 or something. I said this to the other group as well. Don't panic trying to memorize those numbers. You just need to be able to recognize what a very low count is and what a very high count is. And you know a count of 2 is low and a count of 15 is high. You don't need to be worried about like, oh, what if the count is 10.9? Right? We're not really worried if the count is 10.9. You guys know that. At least I never have been in the ER.